Ya, Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. I'm the representation of Group 2. My name is STKA-UHB, and I will explain a little bit for ethical dilemmas presentation. So for the case, here we go. Susan, 20 years old, is a student of 4th semester in public university in Malang. Due to an accident, she suffered total paralysis, and she had to have bed rest for a long time. As a result of the bed rest, she suffered from pneumonia and extensive decubitus ulcers. The doctor decided to apply the infusion and to give antibiotic with high dose to her. When a nurse would do what the doctor ordered, the client refused to be given any medication or any treatments. The client stated that she wanted to die in peace and dignity. One is the process that we call identify and clarify the ethical problem. Ethical principles in conflict are autonomy. And for the types of ethical issue is freedom versus control. And for problem statement is, does the patient have the right to make choice for herself that may result in harm, or can the nurse take control and do what benefits both her and the patient? Because the doctor decided to apply the infusion and to give antibiotic with high dose to her. When a nurse will do what the doctor ordered, the client refused to be given any medication or any treatments. The client said that she wanted to die in peace and dignity. And the second step is gather data. For the relevant fact is, the client had pneumonia and extensive pressure ulcers, and the doctor decided to put high dose infusion, to put a high dose of antibiotics on her, but the client refused to be given any medication and treatment, and the client says that she wants to die in peace and with dignity. Stakeholder and the concern is patient Susan has the right not to be given any medication and treatment. Nurse in charge. The nurse in charge pays attention to the standard of facilities for the care of pneumonia and pressure ulcer patients who require them to be given antibiotics. The next part is identify option. Option 1 is nurses will ignore facility standard by not giving antibiotics and any treatment. For the advantage is patient rights are fulfilled. For disadvantage is pneumonia and ulcer of the patient can get worse, and the nurse may get bad consequences because she disobeys the rules. For the second is nurses will comply with facility rules by providing care to patient. For the advantage is this action can help reduce infection, and also the nurse perform the correct procedure. And for this advantage is pneumonia and ulcer of the patient can get worse. The patient will feel that his request is being ignored. Next is the nurse will consult the case with the doctor and let him or her decide what to do. The advantage is the nurse will not take pressure of the conflict because it's now in the hand of doctor. And for the disadvantage is nurses may feel guilty because they not listen to patient, and doctor decision can be bad. The nurse will give medicine and treatment according to the doctor's decision. For the advantage is can reduce patient infection, and also nurses will obey the rules. Disadvantage is patient will feel their desire and right are ignored. So this is the last part of this presentation is make a decision and justification. For the recommended decision, we choose to say that the nurse shall choose option 3. And the consideration is the nurse will consult the case with the doctor and let him or her decide what to do. Nurses should make a decision with the doctor about what to do to the patients who refuse the medication. Or nurses also can talk to her with the patient about the medication that she has to do. So that's all from us. Thank you so much for your attention. Wassalamualaikum warahmatullahi wabarakatuh.